AM 1040 WHO. Here's something weird for you. Consumer Reports tested 62 sunscreens. Based on those tests, they only recommended 15 of them. Joining me on the WHO Radio Newsmakers line, board-certified plastic surgeon Dr. Farah. Dr. Khan, welcome back to WHO. How are you?
Good. Thank you for having me back.
Well, I wanted to ask you about this. So they tested all these sunscreens at Consumer Reports, 62. They only could recommend 15. So is this telling me, I'd love to hear your takeaway from this. I would think that you not necessarily, if you're paying more for sunscreen, you're not really getting more for sunscreen. Is that what you took away from this?
Sure. I think, a lot of the brands that were listed are brands that I've really haven't even heard of.
Yeah.
But honestly, I think it's actually, the takeaway, you're right. Just because you pay more doesn't necessarily mean you get better protection. But I think really to kind of delve deeper into, what's a really good sunscreen, you really need to look at the guidelines of like the Skin Cancer Foundation and really what dermatologists recommend, because the Consumer Reports story doesn't necessarily tell the whole story.
Gotcha. So look at those guidelines. And that would be good, not just paying attention to this article, these advertisements, but take a look at some of those guidelines. What's the most important thing to consider, Dr. Khan?
Sure. So the one thing you want to make sure is that your sunscreen, it should always be broad spectrum. And what that means is that it covers you against both UVA and UVB rays. The majority of people think that when they buy sunscreen, they should just reach for the one with the highest SPF.
Yeah.
And SPF just means sun protection factor. It only protects you against the UVB rays, which are the ones that cause a sunburn. But the UVA rays are the ones that go deeper and the ones that typically cause like aging, like wrinkles, and then also they're linked to cancer. So so the first thing you need to make sure is that the container should say broad spectrum.
Okay, that's great advice, because I'm with you, Dr. Khan. I imagine that you see a lot of patients that come into you and go, gosh, I've been buying the highest SPF available, and they haven't looked in the package for what else is needed on these sunscreens. Is that a factor that you see a lot?
Yes. And I think, unfortunately, it's almost misleading because people believe just because they buy SPF 50 or 100, they can stay out in the sun longer. But if you actually compare like an SPF 30 with the SPF 50, the difference in how much they block UVB rays is maybe 1%.
Oh.
So really, it's almost like a false sense of security.
Yeah, and I'm also suspicious, Dr. Khan. I wonder if you've delved into this as well, about the waterproof sunscreens. I go into the water, I come out, it's still supposed to be protecting me. I'm suspicious of that. Am I justified in being suspicious of that?
I agree. And, I think with the waterproof ones especially, you have to be careful to reapply a lot more often. Typically, they say you should reapply sunscreen every 2 hours, but
yeah.
With waterproof, it probably needs to be every 20, 30 minutes.
So normally every 2 hours for sunscreen. And again, that's not due to SPF. You just do it, right?
Exactly.
Okay. Dr. Farah, thanks for joining me on this. I appreciate that very much.
Sure. Thank you.